Dozens of patients perished due to the inability of the overloaded medical staff to get to them, monitor them, and provide treatment, including those that were only discovered to be deceased after they had died and rigor mortis had set in, indicated that they had died some hours earlier and that their deaths had not even been recorded, end quote, said Catherine Gahan, a registered nurse for the Detroit Sinai Grace Hospital for the Detroit Free Press on June 11, 2020. Dozens of people died alone in a bed and were not even noticed until hours later. Imagine if one of those patients was your family member. Imagine if it was your brother, sister, grandparent, or parent lying in that bed, unaccounted for, breathless for hours. Just 2 nurses were working that night at Sinai Grace Hospital. 2 nurses who were in charge of the over 50 patients that entered the emergency room. The nursing shortage in the United States has been deemed a, quote, prescription for danger, end quote, by Cheryl Stolberg for the New York Times on August 8, 2012. The nurse-to-patient ratio is staggering, and it is unrealistic for a single nurse to be expected to care for more than 4 patients no matter the status of the patient. Nursing is a profession in which excellence plays a key role and is not optional. We, as a community, can address the problem, tackle the cause, and implement solvencies to change our nationwide nursing shortage. Today, we will discuss the problem the nursing shortage poses on the United States, as well as the patients, the cause of this shortage, and what we can do to bring about positive change during this crucial time. The nursing shortage in the United States poses a major threat on patient care and also takes a toll on the nurses treating these patients. Poor patient care is an escalating situation due to the fact that there are simply not enough nurses to treat our country's growing healthcare needs. A report by Dennis Campbell for The Guardian on December 10, 2019, states that in some hospitals throughout the country, patients have waited between 6 and 11 hours to be seen by a nurse after entering the emergency room. This is not because the nurses are not good nurses. This is merely because hospitals are so understaffed. Most hospitals do not hire more nurses to meet patient needs in an attempt to cut funding and keep their budget at a minimum, and they do so without realizing the harmful outcomes this may pose on patients. As a result of low staffing in hospitals, some patient symptoms go unnoticed and undiagnosed, resulting in complications and even death. Nurses are affected by this shortage just as much as patients are. Many nurses were concerned about their ability to perform safely, with 2/3 of RNs reporting that they had nearly made a mistake at work due to fatigue, and more than a quarter admitted to having made a fatigue-related error, as reported by Nadine Salmon, MSN-BSN for Nursing News Online. Because they are spending countless hours working and treating our community, there is no time left for them to care for themselves. An article written by Diane Miller, RN, BSN for the Lippincott Nursing Center states, in a survey of nurses in Texas, 38% of respondents reported that they had committed a fatigue-related error that could have impacted patient safety, end quote. Now that we understand the negative outcomes of overworked and understaffed nurses has on patients and the nurses themselves, let's dive deeper into the root causes of why this shortage is occurring. There are 3 main causes behind the nursing shortage in the United States. The truth behind the nursing shortage lies beneath the fact that there is a significant lack of funding to hire qualified registered nurses. Hospitals are trying so hard to keep their budget low that applicants are not being brought into a so badly needed workforce. Gerard Brogram, Director of Nursing, states that hospitals, quote, prefer not to be hiring as many registered nurses because of the salaries that registered nurses demand, end quote. Another cause is that schooling to become a nurse is incredibly difficult and competitive. I spoke to a student at Saddleback College who is extremely qualified, and she applied 7 times before getting in on her last try. There are tons of hoops to jump through as a nursing student, and you are always competing against the person next to you. The third cause is that hospitals have an influx of patients and are not bringing in more nurses, mainly due to an aging population and an aging nursing workforce. As reported by Michelle Chen for The Nation on August 7, 2019, the United States has nearly 4 million nurses, more than 1/7 of all the nurses in the world, yet somehow that's still not enough, end quote. Now that I've provided a clear understanding for the causes behind the nursing shortage, we will discuss crucial solvencies which will help end this national crisis. Solvency for this issue would first include all states implementing a 4-to-1 patient-to-nurse ratio. Michelle Chen states that in an article for The Nation on August 7, 2019, quote, setting a standard workload for nurses working in hospitals, a policy that California pioneered in 2004, helps ensure not only optimal level of care for each patient, but also stability and consistent working conditions for nurses, end quote. If hospitals enforce a consistent and manageable patient-to-nurse ratio, patients will have better outcomes and the morale of employees will be improved. This ratio will also lead to less workforce errors due to overwhelmed nurses with too many patients to care for. The care our patients deserve is only manageable through reasonable caseloads. The second step to solving the shortage would be for institutions to provide increased accessibility to nursing programs for future nursing students like myself. Nursing is one of the most highly populated professions in the nation, yet nursing schools turn away thousands of applicants every year. Quote, in 2017, nursing schools turned away about 56,000 qualified applicants from undergraduate programs. Go back a decade, nursing schools have annually turned away about 30,000 applicants who met admission requirements, end quote, according to the American Association of Colleges of Nursing. Lastly, there are two predominant ways in which we as a community can provide solvency for the shortage of nurses in the United States. The first way to solve is by donating to hospitals and nursing schools and working to spread the message about overworked nurses. Imagine the impact it would have if we all donated $1 or gave up our morning coffee run for a day to help support the salary of our frontline nurses and future nursing students. According to an article for Onward Healthcare by Kelly Lanigan, RN, the top 3 foundations to donate to are the National Student Nurse Association, the American Nurse Association, and the Sigma Theta Tau International Honor Society of Nursing. The second way we can help curb the national nursing shortage is by simply spreading the message about how overworked nurses are. Many people do not even realize that this is an issue in the healthcare field. We must understand that the higher nursing staff numbers positive correlates with improved patient care and reduces the number of workforce errors. I know that you can share posts on Facebook about the shortage or talk to your friends about it or donate to a GoFundMe to benefit your local hospital. I know that together we can make a difference. I have been working to become a registered nurse since 2015 and it has been the one thing that I've strived for my entire college career. Not only is the road to become a nursing student packed with crucial information, nearly impossible science courses, but it is extensively time-consuming. Every class matters, every grade matters, every assignment matters. I have been working tirelessly to join a field that so badly needs candidates, yet is almost impossible to enter. As the nursing shortage in the United States continues to grow, I urge you to use your voice and speak up. Encourage all states to implement a 4-to-1 patient-to-nurse ratio and encourage colleges around the nation to be more accepting of all students at all levels. The information researched in this speech was found on the following databases: Dennis Campbell, Nurse Shortage Forces NHS Hospital to Shut Down Critical Care for The Guardian, Pat Conrad, Take a Number for ProQuest, Robert Dupree, Primary Care Shortage, Whose Problem to Solve Anyway for ProQuest, Rebecca L. Fox and Kathleen Abrahamson, The Critical Examination of the U.S. Nursing Shortage and Contributing Factors and Policy Implications for Nursing Forum Online, How Bad is the Nursing Shortage for Modern Healthcare, Kelly Lanigan, RN, 10 Nurse Organizations for Career Development for Onward Healthcare, Looming Nurse Shortage Fueled by Fewer Facility Training Sites for Modern Healthcare, M. Marquet, A Nursing Shortage, A Prospect of Global and Local Policies for the International Nursing Review, Diane Miller, RN, BSN, Running on Empty, The Fact About Nursing Fatigue for the Nursing Center Online, Sinai Grace Nurses, Dozens Die Because Hospital Was Short-Staffed for Free Press, and Cheryl Stolberg, Patients' Deaths Tied to Lack of Nurses for the New York Times.